Okay, welcome and good night to our viewers. Welcome to the Alliance of Change on the Move. Tonight we have two special guests in the house. Um, we have Dr. Colin Haynes and we have our RDC Council in Barbary Region 6, New Amsterdam, Camille Cox, who is also a national executive member. Um, So tonight we have a lot of topics key up for you guys. We'll be dealing with some health issues. We're then dealing with some NIS issues, some matters on forestries, matters on rice, and of course the latest political situation that is seen happening in Berbice, where the PPP supporters are attacking political activists. Um, so I would like to start tonight's program with Dr. Haynes. How are you? And welcome to tonight's program.
Yes, hello, good night. It's a pleasure to be on the show. It's very good to be here back once again, Ricky. I know it's busy time for us, but nevertheless, we're always happy to be here to speak with the people of Guyana.
Thank you. And Camille, welcome to the tonight's program. All right, so Kalimila join us as soon as she gets ready. But tonight, Doc, so tell me what's going on. We wanted to talk about this health voucher that is going around in the country here. Can you tell us some of the issues pertaining to that and what you want to discuss on that matter?
Yeah. So, matter of fact, I look. I just want us to be very clear that we were the first party that mentioned anything about giving some of the patrimony that we've gotten back to the people of Guyana. You guys may have realized that when we first said that through Clive Thomas as part of the coalition, that it's been a standard practice, when it was Norway or many other countries, they've given back some of that money back to the people. And so remember the PPP said it won't work, people would be irresponsible, so many other things, right? But now look at it. They've just got given out 100,000 cash grant. They're now giving out monies for when babies are born. They're now giving out this healthcare voucher. And look, I am not against this giving back to the people. I mean, it's our money. But I think that a healthcare voucher presents some problem. As a matter of fact, I actually went and collected mine a few days ago. So in the back of the voucher, it shows you all the different tests you can take, and all of them are preventive tests, right? However, it doesn't seem that there is an accountability measure, because when you go to collect your healthcare voucher, and let's say I live in Providence and I go collect in Echoes, then I can now go to Diamond and pick up the voucher as well. There's nothing that is actually preventing me from doing so. So I don't think that they have accountability measures in place. And again, the ministry, there is $4.5 billion that's been allocated in this last budget towards family and preventive medicine. And we have a lot of problems there. We have problems in terms of, access to care. We have problems with testing getting done and so forth, right? Basic testing. So why don't we take that $4.5 billion or $5 billion and you add it towards the same thing? So you scale it up and say, now, I have nothing against the private sector, and certainly people have a choice. But when it comes to public money, it must reside with the public, right? And so you take that money, you ensure that all the tests are available at every hospital, every health center, every outpost within the country. You can get your CBC, you can get your A1C, you can get your lipid panel tests, and these are the tests that they're running, right? And I think for a fraction of that cost, the government can provide that service to every single person.
I totally agree with you. I totally agree with you, Colin, and that is what we are fighting as much as we can because, I mean, healthcare. I mean, you want to improve healthcare for every single person, every citizen of this country, and that's what we are fighting for. And you're absolutely right that some of these programs we roll out. Can you mute your mic when you're not On. Yeah, so Alan, that's a very important aspect of the discussion, and really wanted to tell you also that we have seen that there are a lot of hospitals they're proposing to build across Guyana, and
Mm-hmm.
that some of their friends are also building some private hospitals. I don't know
Mm-hmm.
how to compete. So to argue your case, it will show why the money is always less when you go into these vouchers. I mean, $10,000 I see is one. Maximum I think was $15,000. And
Yeah, there. I think there's $10,000 of preventive care. There you can also get $10,000 voucher for children as well. And here's the irony of children. If you've got, let's say, you've got a less than a year old, and they collect that voucher, I mean, they can use it for regular checkup. It has specifically that children must get like an electrophoresis test done or something. So it should actually say that kids there's a cycle, there's a graduation every month, every 2 months or 3 months. They go see the doctor, ensure that their weight and their height as well, sure that they're meeting up with the WHO growth chart. But no, it has some very complicated tests because, like I said, I collected one for my family, I collected one for me, my family, and look and see what it has. And I don't see where a child, unless a child's very sick, that's the only way that covers, and that's not prevention. And so
absolutely,
this whole thing
absolutely,
is it's a waste of time. It's a waste of government's money, and essentially it's to put money back in the pockets of businesses, friends. That's what is.
absolutely. And that's why I mentioned to you that there are some private hospitals that have been set up that healthcare is going to be a very major thing here. And, I wanted to see, rather than building more hospitals, is to you put the trained nurses and doctors to work on these hospitals. They expand the Georgetown Public Hospital. The government should be able to do
Mhm,
more in terms
mhm,
of training its own citizens into the
mhm.
healthcare. Healthcare is one of the aspects which we as a party will focuses on. That we have
Look,
to get proper healthcare for elders. I mean, that is
yeah,
where my vision is.
correct. Look, we already have a shortage of 4,000 nurses, right? Within Region 4 alone, they're building three new hospitals, one at Ogle, one at Diamond,
And more.
and more, right? Good. And they're building 12 around the country. If you look at the budget, the minister last year, his budget for his office only, because I guess that's where the money's residing for these projects, $100 billion. Now his budget is almost triple, $300 billion. And there's not a lot of great of accountability. The other thing is that you're building 12 new hospitals with a shortage of nurses, 4,000 nurses, right? So we at the Alliance for Change, like I said, I am not the person just to go come here and criticize. So what we're doing, we're creating one of the most comprehensive health plans the country's ever seen. You know, from administration to administration, they've had what's called health vision. So that's the roadmap. But the last 5 years of the PPP, there's no roadmap. Health Vision expired in 2020, and now the health sector basically is on like pilot, autopilot. The minister, he's a very, I don't know if you've heard him. He's very insipid. He's very bland. Like you don't really get an enthusiasm from him that he really wants to make things happen. And so you're on autopilot, business as usual, contracts for the friends. You have a shortage of nurses. We may not be able to meet that shortage without increasing the number of nursing schools and also increasing enrollment now. But also, you have to hire foreign nurses. When you want to make up this gap, you have to think about critical things. You're bringing foreigners into a country, how adaptable they are, how well they know the language, how well they'll gel in with your people, right? The Filipinos are probably the most perfect people you can get to fit this bill. But then we go bring people from Bangladesh, right? That doesn't understand our language, that doesn't understand our culture. Bangladesh got around 130 million people, and they don't have the best healthcare outcomes as well. So you see, this government in the health sector, this government the plans are not coordinated because you don't have a plan. There's nothing you're starting with. So these are some of the things that we're saying we're going to do. If you want to hire nurses, let's hire some nurses from the Philippines because they eat rice in the Philippines. And I'm just saying this because, it's true. I've been to the Philippines. So they'll be more comfortable here. The weather here is like the Philippines. The language, they're some of the most adaptable people. They go to the United States, Canada, UK. They go all over. They're the most travel nurses there they are. But we
Colin,
have to get
I
more
really
nurses.
want to agree with you on that point, Colin. And you're mentioning here what you call quality. Quality of
Mhm.
healthcare. You just can't compromise quality with healthcare for any, I will say donkey dam, because we're talking to people in Barbies here too, right? We got to talk the local language.
Yes.
Have to get people, health is a very serious issue and serious matter. And we have to deal with these issues as we go along. Camille, we have Camille joining us. Camille, unmute your mic. Um, Welcome to the tonight's program. And I wanted to be talking about healthcare, and I want you to talk about those health facilities locally that we have in Region 6, if they have the medicals, like the basic things like aspirin and Panadol and so on in those health facilities, because I know it's been an issue right across the country in this local health facility.
Yes, good night, MP, and good night, Colin. Thanks for having me on your program tonight. Good night, Burbies, and countrywide, because I know the program still goes countrywide, even though it's a Burbies program. On the point of the nurses, well, I must say, God bless the dead. Javon Stephen had an initiative where he employed I can't remember what they call them, but some of them, the community health workers, which used to wear the black and white, and the P something something, they used to wear the blue, like a baby blue and white. And all of those persons were sent home when the administration changed. Lo and behold, I was so surprised last week to see they employ back these PSOs or P something they calling them in this in the baby blue uniform. It was so amazing because they sent home
PCAs.
these same persons when they
PCAs, I
took
think.
over. Yeah. And now they're taking a whole batch of them again. It's like, where's the use you sent them home? And now you have to reinstate them back into the health sector. What was the point? Is it that you're trying to add that in to say that you created jobs?
Yeah, Camille.
When it,
Yeah,
when it comes to some of the facilities, yes, they have some of the facilities, but they are not functioning. Now, my biggest thing is the dialysis, and we have spoken about it before. The outpatient dialysis and the amount of money they have to pay, and in Barbies, you have to pay this tremendous amount of money to get dialysis. When you are inpatient in the Joshua Hospital, you get it free, but as soon as you come out, you have to pay. I mean, how ridiculous is that? How ridiculous is that? Some of the complaints that you've been getting is like band-aids. They don't have band-aids.
Mhm.
Um, the person at the foot care, some of them, the nurses are getting problems with really taking care of the persons from the foot care center, which is like, what's going on? What is going on? Right? And then persons will you getting complain about the 10-day workers not being manned properly and all these kind of things. It's like chaos and confusion. That's all I can say. Chaos and confusion. Because week after week we talk about these same things in council and nothing has been changed. It's just you talk about it and when council finish, that's it.
Camille, and see, this is where the problem is that it raises at the councils and nobody pays heed to it because the persons who are chairing the health committee is probably don't qualify to deal with these issues. And that is a problem that we're going to get. And that's why we talk about quality with Dr. Haynes here
Mhm.
tonight. And I know that you want to mention, Dr. Haynes, something on the electronic medical records. And I know where you're coming from in terms of systems and management. because
Right.
I mean, we look, it has been really overdue. If you're going to be talking to a fastest growing economy, if you're going to talk about 21st century country, if you're going to be talking about these things, you have to get improvement of medical records, and it should be implemented. I think the laws already passed for that to have it there, but it should be done
Mhm.
because any hospital I go to should be able to pull up my records.
Mhm. So, there's great deal of having electronic medical records, right? I've been doing this. I've been in the EMR business for over 13 years now. So it promotes patient safety. So doctors' handwritings are not the best, right? So a
Right.
nurse could actually read and see benzidine, and there's another drug called benzatidine, and they can give the wrong drug. And by the way, this has happened many times. I've heard in the healthcare sector here in Guyana. And so it promotes patient safety. It also allows for the easy collection of data, so you can analyze data, right? They've got tools that can look at data, how well the population is. It can also be able to use as a way to effectively track better service outcomes. So clinics, like I know I've worked in the United States, and Europe, and Asia, is you can actually look and see how well you're performing, right? How many patients you're seeing a day, how many patients you're seeing for a particular disease or something. So the advantages are enormous, right? And one of the things we're going to do as well in the Alliance for Change is we understand that this is something that in government will have to deal with, and that's where we're going to create a new program in the Ministry of Health called the Health Information and Climate Change. The reason why we're adding the two is because we realize that climate change also ties in with health outcomes, right? And so we want to be able to bridge the two and be effective. So we're looking at two new programs we're going to do. We're going to bring mental health as one program because right now it's somewhere lost, out in nowhere. We don't know what's going on with that, being one of the highest suicide rates in the country. And then we're going to do that. Now, the way how this thing is implemented, just let's follow me here. You've got particularly countries like the United States, right? We have better internet service. We've got access to machines. We've got complicated patient workflows and things like that. And it takes a health system sometimes 10 to 15 years. And if they have 13 hospitals, like I worked for Columbia in New York, it takes them about 20 years to get this thing going, right? The Ministry of Health, with 30 something hospitals, including Georgia Public Hospital, over 100 health centers, is trying to get this done in 5 years, right? So let me walk people through how this actually works, right? Because you're hearing this from an expert, and I'm not shy to say this because I've done this umpteen times over. The first phase you go through is called a forecasting phase. So you got to decide what EMR you want. You have to also pay attention to the needs. So Guyana needs to have an EMR that in the interland, it can work either on low connectivity of data or no data at all. And there's systems in place that you can have in their EMRs out there. You can get them, and they can download the data at the end of the day. You can upload it and so forth. And so now it becomes accessible on a server. Now, with our internet issues that we're having in this country, there's no telling how we're going to get this information up on a server, right? And now remember, it's not just one hospital. It's 30 hospitals, 100 health centers, plus they have some health posts as well, all right? Now you're going to add 12 more hospitals. So you're looking at almost 40 hospitals. You're looking at almost anywhere around 200 health facilities, all right? So you have to ensure that you have the capability for that. Now, the other phase is demoing. So you normally would go through some demos. They have many companies that come in and they would sell you this. I've worked with two of the biggest ones that they have, right? It's called Cerner and Epic. They wouldn't work very well in Guyana, I tell you, because of the internet issues and data and stuff. The government now goes out and says, well, we don't care about the demo phase. We're just going to go buy something blindly. We're going to spend 3.3 million US dollars, which is 660 million Guyana dollars, on something that blindly that we don't know. We don't know how it's going to connect. We don't know how it's going to integrate. So that is another important piece, because the EMR sits there, but it just doesn't work because you got X-ray machines, you've got blood, you got the lab machines. They all have to integrate, right? It's a process called integration. And so After you forecast, after you decide that you're going to look at a demo, you got to look and see that how is that done. Now, how are we documenting now? We're documenting on paper. So companies that health facilities have been on paper now have to get used to computers at desks, and you got to sit there and document within the nursing station, or you also have computer on wheels, right? Ones that you ride around. They're called cows, but in the United States, we changed them because they had problems with people calling patients cows, right? They thought that they were being called a cow when it's actually done with the computer. So they call them WOWs now, workstation on wheels. So you got workstation on wheels. You got, it's a fancy setup. It's a computer on wheels. You push it from thing. There's also in patients' rooms that you also put computers as well. You also have scanners, right? You're going to scan because in order to collect blood, you got to scan the patient's bar, scan the medication. You see all these things I'm telling you about? I can tell you that this is years and years and years because, like I said, in one of the most developed countries in the world, it takes them years to get it done. And we've also had a terrible history of implementing EMRs. We tried to implement an HIV program back in 2017. We spent almost $700 million. There's no EMR. Now we're going to spend $3.3 billion, 600 million, and probably we're going to have the same results. So we're now spending 5 times more, and we're probably going to get it. And for the life of me, and this is not about me or it's not about my wife, because we happen to be only like the two experts that exist in Guyana now, but I don't understand why we weren't consulted. You've got two people who in the country who know how this thing works, have done it over and over again. And for some reason, you hire a British firm to bring in this software called RioMed. And we don't also know the terms of this as well, because are they just giving you the product? Because the product is one, but to implement the product is another set of money, because we haven't talked about training. You got to train all your staff. Then you have something called Go Live, where the system goes live, and you need to bring people to be able to show them how to document, how to chart my meds, how to chart assessments, how to chart vital signs, blah, blah, blah. You also have to ensure that the vital sign machines as well are crossing over, because you can buy these little AccuChecks and have them docking and that kind of stuff. So this stuff is very sophisticated. I'm just telling you this because of experience. And it seems like we're out of depth with this.
Colin, so I'm happy that you brought that up because you spoke about connectivity. Look, and you mentioned the figures, 200, about 200 medical facilities. We have enough money. You're going to build 12 hospital more, but you can upgrade those in the interior location, because that is where my mind is. And you can
Right.
establish communication network to help to do the medical records that you're talking about. You
Right.
understand? So you can come to a central system. And don't
Right.
tell me that is impossible, because we have system now where internet can be improved at these locations. And I wanted to link here, guys. I wanted to link some NIS issues when it comes towards these as we are on the health. Look, I've been receiving a lot of reports on NIS pensioners. People are work so hard. They work on since the 70s. I got an uncle right now going through the same process. When you go to the Georgetown NIS office, they give you, oh yes, you're qualified. When you come to the local office, oh no, you're gonna give you a grant. This betrayal to our pensioners here across this country is unacceptable. And it is respecting to them, because those are the people who deserve to have our better care, because they have served their life to work in this country. You understand me? And this is not fair to them. And Gaisuku, and I know Gaisuku has a lot of issues to paying people NIS and so on. So offer people that grant, Colin and Camille, it is not the right thing to do. You can give people $20,000, $40,000 grant, and then you just shut them off for the entire season. You know what I mean? This is not right, and we have to address this issue. NIS need a total cleanup.
NIS need a total rehaul.
Yeah.
Yeah.
So I think, so I went to NIS recently, and I saw the same problem actually, because I saw an elder lady saying that she lived over the river, which is a region 3, and she did all her paperwork there, and she's now there at the main office on Brick Dam, and they're telling her that she got to go through some more paperwork. So again, you have oil money, you don't have a million people. It's not very hard to put everything online, make it digital, make it more easily accessible. You can also have systems where people can go to certain folks and get it signed up, because I know the older folks, they're not very well with technology. But you've got to create a centralized system where people can be able to access information, input information, and also when you get to the NIS, you had reciprocating, because ladies saying, I got to do the same thing all over again, duplicity. No, I don't believe with the grant. Look, I think that we could either find a way where we could lower the credits. And so let's say you needed maybe, I'm just saying, I don't know how much the contribution amount is. Say you needed 150, you can now drop it down to 100, because also you have to take into consideration self-employed folks, right? Being self-employed, it's a very up and down thing, because sometimes you get a gig, sometimes you don't get a contract, sometimes you break even and so forth. So you have to lower that, and you can make that up easily now. Like I said, we have our money, and I think people will be more happy knowing you get $40,000 old age pension, and you get another $60,000 or $80,000 from NIS or something like that. And I think we need to raise pension as well, because people living in Guyana now, I don't think if we don't have 200,000, I think we're living in poverty if you're not at 200,000.
Absolutely. And Colin, thank you so much for raising that. Camille, you want to? No, I wanted to I want to come back.
For the longest while, I've been. One person said to me, their NIS pension for the last 10 years, the last 8-10 years is $40,000. The NIS pension is not being raised.
Camille, thank you so much for bringing that up, because that is where it is coming. And Colin, thanks for raising that point. I mean, guys, the contribution is 750, and you're absolutely right. We can lower that, and that's some of the policies that we put in place, Colin, when we get back into office, because we wanted to work. I mean, I have a special, to me personally, I have a special thing for the elders in this country. I'm talking about see pensioners line up for money at post office. That is so unethical.
Really? And some of them don't even have breakfast before they come out. It's ridiculous.
You know what I mean? And so sometimes when I say, oh my gosh, when I pass at Melanie, when I pass at Enmore, I've seen people lining up on these for these pensioners. Anything that they'd like to line up, the government like to see people line up. Some people get them blackout and all these things in the lines. It is not right. These are people who work their life. You know what I mean?
Yeah. It's a way of trying to subject the population. All right. So if you look at the Soviet Union mindset, right, to try to subject the population, you have them sitting in lines, you have them helpless, you have them like beggars in their own country for their own money, right? And so, like I said, people get bank accounts. Around the world, people get their pensions in bank accounts. They get their social security in bank account. They get their
absolutely, brother.
Why is it that we can't figure out a way now to just channel money into account? You're paying people already that way. Yeah, they recently had an issue in London, I was told, where the nursing students weren't getting paid their stipends. They're only getting paid $16,000 a month to go to nursing school. And some of them are single parents. Ricky, Camille, what can that do? $16,000 at $16,800. When we get into government, we need to up that at least $100,000, because, I mean, just to transportation alone, I think that money is done in a week. Just transportation.
And Colin and Camille, the head of state wanted to know why the UK is taking our nurses. Why you take? It's not the people are taking the nurse. You have to
clear as day why. Yeah. Clear as day why.
And the US and Canada.
You understand? You have to train. You have to pay your nurses. You got to train them properly. You got to provide for them. You got to ensure that they're being well taken care of. And look, I want to come to Gaisuku. Gaisuku needs to get it up together. You understand me? That pension thing that they're holding back and they don't pay the people their money, You understand me? It's a terrible thing to do. People have died. People died and never received a pension. Fighting cases. I know there's several persons coming from Barbados complaining about pension. You understand? They're
Mm.
not getting the contribution because you know what? I heard that these people are selling out. I don't know how to do it, but they're selling out people contribution to match up to match the numbers. I don't know how to do it. You understand? But Colin, I want to touch on a very important matter is that we will improve the digital divide. We have to
Correct.
improve that. People should be able to plug in the NIS number and go online to see how much contribution they made.
Correct.
Why
Right.
go line up in Georgetown or go line up to all these offices? We got to
Right.
do better than this here.
Right. And so it'll also help out making the system more efficient.
Of
So
course.
whenever you can plug in and see that, and you can also apply and put in information, then when you go to NIS, it's a quicker process. They pull up your information quickly, they look and see what's going on, and they deal with it. Now, also another thing I think we're lacking behind in Guyana now is the ability to resolve issues. So big companies like NIS, GT&T, and so forth, and we are doing call centers here. You know, you hear Teleperformance is closing down because they're losing clients. Well, their biggest client could be the government because you pick up the phone, you call a number. If you're an elderly person, they can look up the contributions for you. And literally, this is what happens. I don't want to make the US example, but it happens in all countries, including the one that the president is fascinated with called Dubai, right? These things happen very easy. So you can pick up the phone, call an older person, call them. Matter of fact, they should have these WhatsApp. I know e-networks have that they could WhatsApp or call on WhatsApp. And you ask about your contributions, they tell you, they walk you through steps how to get it done. You could even apply for certain things on the phone as well. And like I said, a country that doesn't have 1 million people, I don't see this being a problem. We're gonna have more oil than people very soon. We're gonna be the largest oil per capita nation in the world, and we still got 50% poverty. We still got people standing up in the line waiting for stuff.
Thank you so much, guys, for this here. And I wanted to touch on another issue here. And before I go there, I know you talked about the USA, but I must say that I must apologize on behalf of the Alliance for Change. We'd like to apologize for the Secretary of State for nearly having a concussion on the road that was built. And the road was built by the PPP government, and it was built by the friends and the family and the favorites.
That's right.
It was never built by the Chinese. He was
Sure.
wrongfully being fed with information, and we would like to correct that. And roads has been an issue. And since I'm on the road issue, I would like to talk about the interior roads because there are some matters and issue with forestry. You know, I've seen Camille and Colin. I've seen that a lot of contracts have been given to maintain the interior roads.
Hmm.
And the interior roads are not being maintained in the way they're supposed to be, and therefore hinder productivity. And there's these engineering who are supposed to go and check on these roads are not doing so. So therefore, the people are taking the contractors are taking, and I call them Qatar contractors from since the last program that I did with the guys there. They're not doing the work, the quality work they're supposed to be doing. And they're not, and the equipments them apart. You don't know who's doing what. They're barely scraping the road at the top, and by the time one shower rain, it's gone back to square one. They're just wasting the money, and nobody checks on them. You understand? And this system of forestry is, look, I am going to be dealing seriously this time around with forestry and roads and these contractors and so on. I told David Patterson that we will do an audit on all the projects that is done in this country here. I've known that people in Barbados, Camille, right in your area, have ghost company collecting money for ghost companies. And they buy 3, 4 vehicles in a month that can't pay people. This morning I got a call from one of the 40 stakeholders. One of them got $14 million for him, but he bought 3 vehicles, but he can't pay the man for he piles. These are things that has been stifling the development of this country. When people like that are getting away using the government money, using our taxpayer money, and get away with murder, they're not paying the money down the line. And we'll
Put
be looking.
aside, put aside paying the money, Ricky's. These things that they're billing for roads, it's ridiculous. Because before that was built, now the road have the measurement has a certain amount of width, right? Even though it was bad, two vehicles could have passed. Put aside the holes and the bumps and whatever. Two vehicles could have passed. Now, the things that they're building, two vehicles can't even pass. One has to pull down. Look, I can say that because I'm a driver. One has to pull down in a corner, almost close to the drain, for one vehicle to pass. And then you will come out. If you cannot drive or you don't have that average away from a drain, you could end up in a drain for a vehicle to pass you. Some of the streets you come into the street, you gotta blink your light. You understand? So
Yeah.
in a form of communicating with the other driver, whether they must come or whether they must wait. It is ridiculous. Some are walk parts and they are building them as streets. Look, I'm seeing in Islington where it's a residential area. It's one long lot and one long lot with different house, right? Different family. Lo and behold, I see contract give out to build a walk part for a family. Like, this is crazy. This is crazy. How come the government is building walkway with our tax paying money for a family yard? It is ridiculous. That was not a street. So how can you do that? What is it? Just for a person to say, okay, or is it these little contracts given out as to buy votes? What is going on?
Mm.
I know for sure that is a family yard. That is a family yard. How come you
Camille,
get a walk?
Camille, thanks for bringing that issue up. And as I was mentioned, this friend, family, and favorite. And I want to talk to those boys in quarantine that is operating their sawmillings and the logging that having difficulties in Quarantine River. You know, and there are a couple of things, as I mentioned before, that we'll be doing when we return back to power, is that we are going to be changing the model, the way that we do forestry operations, because those guys are, when they bring in the produce in the river, they have to work with tides. And these are some of the issues. I know, Colin, we talk about the health and how you can improve that. We have this, we talk about the forestry sector, what we're going to do to improve it, because we are going to be changing those management systems where those guys have documents that can expire in 30 days, and then it takes more than 30 days to bring out the produce from there. So that will be extended. We have to create a separate permit system for those guys there. What we will do also, we will ensure that those roads that GGMC is building with interior roads, we are going to ensure that they're managed properly. We're going to ensure that the contractors are held accountable, like we used to do it under the stewardship of David Patterson. Those roads used to be tip-top. Raphael and David, we work it out because it was Raphael who says, we are going to be using GGMC money to build those roads. But we never used to build them Kantar road that they're making now. We used to build proper roads. Nobody never used to complain. If you look at the Latham road to come there, it's chaos. People are going through mud up to chest height to pull out trucks to go across just to get fuel, to get productivity. I know they want to know what gold declaration.
Just say the concussion road. We'll understand.
Yeah, the concussion roads them.
Yeah, so we went to Kokwani the other day. Camille, we were there, and the road is not the best. That is a concussion road. I think. I don't think the Secretary of State's on a concussion
road. Yeah,
I really don't think he did. And you know that he was paid to say these kind of things, right? Because he was lobbied. I mean, one of my biggest gripe is, the last two Secretary of States, when they come to Guyana, particularly under the Biden administration, he met with the opposition. This time around, the opposition was nowhere. So in Washington, there's a street called K Street, and you've got a bunch of people with money who are trying to get a certain agenda pushing government, right? They're trying to ensure that this government stays favorable, does all they could do. And that is exactly what the secretary came the other day to do, right? He come to be able to he was paid to push a certain narrative. And this is what sometimes the Americans are pretty good at doing, right? It's pushing narratives of things that are not true. Because there's no way I drive an Euro every day. And I probably would have had a brain injury as well. Me and my family, we don't. I think that for all the money I've been hearing going towards the Kokwani, the Latham roads, they should have been tarred. Look, if you were in power since 1992 and you did maybe 5 miles of road every year, you can get that road done. It should have been done by now. But for some reason, we tend to be giving money to contractors who just grade the road, put some laterite on it, and then that's the end of it, right? But what do we need to do is understand that a road is not only a nice paved strip to get to somewhere, but a road brings money as well to government. It's commerce. We're going to do the bridge, Harbor Bridge. So that's going to increase businesses between the East Coast and the East Bank and the West Bank and so forth. So you've got a road going to Kokwani, particularly, I'm from Linden, so I'll make that example. And, at every stop, whether it's after 10 mile, 50 mile, whatever, people start getting lands there. Businesses start opening up. You can stop there whenever you want, buy a drink, whatever the case may be. People start living. That's how communities develop. Aichuni is one of the older communities, and I've noticed that Aichuni looks a lot more rundown than Kokwani is, right? And so if you bring the road through there, then you give people more incentive to be able to come there and to spend money and so forth. It's an excellent stop before you go to Kokwani or you're coming back from Kokwani. And so that's what roads do. I mean, the PPP, I heard build a road to nowhere. These are actually roads that go into some places, right? The interland of Guyana, through Linden, going all the way down to Latam, Madia, to Bartica. Do the roads,
we have a program. We have a program, Colin, that we're going to lay it out. That we're going to bridge these area, the interior roads. We're going to bridge them. We're going to bridge those rivers that we are talking about, like the Shirima crossing, the Kurpakari crossing, the Hydro cross, the Botakari crossing. We're going to build this because access is important. If you don't give people access, they're not gonna. You're not gonna have development. To have development, you have to build this road, to build these roads and paving roads. And we have enough money to start paving. If every year you pave about 30 kilometers of road, you will do well fantastically over 4 years, 5 years time. Yeah. You understand me? And I know that those roads, all you see this project that's going on around this country, it was our government that put those projects there. Mm-hmm. Understand? Mm-hmm. There's our government that done that, and we have to ensure that the government is saying that they're fearful that many of these projects are going to be continued. What makes the project they're done? The gas shore project, we had a project, but not that location that they're talking about. They just move it from a location and take it there. The Demerara Harbor Bridge, we put that project there. The Hero Highway connecting to the Suzek Linden Highway, we had money already for that. It's just a turn the spade. You understand? That Brazil road, Linden to Brazil, we had the money from the UK government done secure for that. If the current government wanted to take away back that money, and the UK government said, well, you know what? If you want that, don't build a road, give him back my money. You understand me? We have done all these projects we've done. The one from the 4-lane bridge and Linden. That's our project.
Right.
They have not done no massive project here. The only thing they're building here, which is using money from Exxon, is to build a stadium in Barbies. Mm-hmm. You understand me? All those there, we have secured money. That extension for the embankment, we already secured money for that. Mm-hmm. When they're talking, they should bring the documents to see that, okay, we signed it off.
Right.
You understand me? They can't come and saying, but we're going to abandon any project. There's no project that they're putting that we're going to abandon. What we are afraid of is that gas ashore plant, gas ashore plant, energy plant, where they're going to end up like Skeleton Sugar Factory. That is what we are afraid of. That's why the White Elephant that is there. They had a set of White Elephant projects that they had. Yeah. They had a fiber optic cable that was White Elephant. Just we are not going to continue projects. The specialty hospital was supposed to build in front of UG Turkine. They person thief that money from them, and they never see that money. You understand me? You're going to tell us about, but our projects. You have not done any project to this country in the last 4 plus years. You are just in the project that we left off with, and you're just moving that gas shore plant. It is going to be dangerous at the location that they're going. That's why the guy who is building the foundation, taking them backside to court. Sorry, I had to say it like that because it's stupid. They don't want to do this feasibility study.
Mm-hmm.
Listen to technical people calling you in the medical field. You just now mentioned the whole thing about the EMRs.
Yes, yes,
You
yes.
understand what I'm saying? You
We
have to understand that there's a certain line to be drawn when you're
mm,
talking politics and when you're talking about the technicalities of issues, and that is why Nigeria is quietly created. There are certain sectors that we should work together, including the education,
mm,
the health sectors. We should work
mm,
together to ensure that those sectors are built. The training for our people, the
right.
university level. We're not putting the money where it's supposed to be.
Mm-hmm.
You're building the roads. The people are gonna eat the road,
No,
huh?
our
That is why
schools
when
are
and look, I want to
really.
touch this issue. That is why when Mohammed is going around now around the quarantine and in Barbies, the people are flocking him because they're fed up. They're fed
Mm-hmm.
up.
Yeah. Yeah,
And
people
what
are
the people
naturally fed up that is causing that. Fed up.
Camille, and when the people and that is wrong what they're doing. PPP not supposed to be blocking anybody who wants to go and talk to people. That is not democracy. You
Nope.
understand? That's hooliganism. And the people of
Remember,
Barbados must understand what they wanted to do to you. They
remember,
don't,
these are the guardians of democracy, right? Remember, these were
yeah.
the most
Alan,
democratic people that existed.
I want to tell the people in Barbados that the PPP don't have a transport for your life. They don't.
Correct.
They are killing the people and contracting Barbados billions of dollars. Go and look at all them houses that they build. Go and look at the vehicles that they're driving. What are you driving? Huh?
Mm-hmm.
But
What are you driving?
Ricky, I would like to come in here, if I may.
Sure.
I've been listening to Mr. Mohammed, and I haven't heard him say anything that is politically motivated as yet. I haven't heard him say anything in the political field as yet to cause the ruling administration to be going on like this. I haven't heard each one of the lives. I even read the things that he posts, that the team Mohammed would post, and I have not seen anything that is posing a threat to the AFC, the PNC, APNU, WPA, PPP. I have not seen him say anything that is a threat to us. All I can say, this is what this man have been doing for years. It's not something that he now started doing. He's been doing this for years. Is it because it's a election time that he's continuing it, that is causing people to look the other day he said he didn't come, I didn't come with my car, I didn't come dress up, I didn't wear watch, I didn't wear this and that, because persons are saying that people are running behind him because of this fancy, well, the vice president, that because of this fancy vehicle. See, he came as normal as possible. And persons were still flocking him. What that tells me is that people are just fed up and they want change. They want
Mm-hmm.
something fresh, something new, and that is what is drawing the people to him. Because
Right.
until now, he have not said anything
Mm-hmm.
political.
Mm-hmm.
I mean, I'm in politics for so many years.
Mm-hmm.
I have not heard him say anything politically. Well, yes, he's been throwing some shades here and there, but to come out and say, look, I am running, I am doing this, I'm doing that, he haven't said that. So what is all the confusion about? What is all the protesting about and calling him all kinds of names? He is a Guyanese, and he is free to people are free to assemble and
Mm-hmm.
meet with people and have discussions with
Mm-hmm.
anybody. It's Guyana.
Correct.
And why we cannot be free to do that as a born Guyanese? It's not a
Correct.
foreigner coming to Guyana doing this. It's a born Guyanese. Don't matter what race or religion.
Mm-hmm.
We have a right to that. The
And
Constitution say we have a right to assemble, a right to free speech. So
Cam-
what is it? Are you going to tell me tomorrow if I decide to gather a few people and have a meeting, then they will do the same to me? Is it that I have to look forward to?
Camille, Colin, this is where I'm fearful, and I want the citizens of Barbados and all across Guyana to take note that who drew the first blood. I wrote an article and I get to publish it. They drew the first blood. Look at that woman in Barbados, right, that raised her hand to slap that guy. Look at the
Yeah,
arrogance and the ignorance.
Ricky, if there weren't cameras
Yeah,
around, if everybody's phone was not out to tell the truth of that story, that man might have been charged.
he would have been in jail. He would have been in jail.
Because as
Yeah, that is.
soon as the police saw the videos, they released him. Because she first went to the station and make a complaint that he hit her, and it
Yeah.
was not so. And
Correct.
I can tell you that because I spoke to a certain police officer that told me what happened. She first go to the, and she's the person that hit him.
Yeah,
Now,
Jonathan.
for what? For what? Because he decided to go and listen to Muhammad or see Muhammad. Lots of people, I feel, they just hear about this Muhammad and they're going to
Yeah.
see who is this Muhammad face to face. And you cannot be annoyed with people for wanting to know who is this person. Ricky, you could be out there and your name could be on top. And people will want to know who is Ricky Ramsrud. I am going to see who is this Ricky. I want to see this Ricky for myself. If he got a cut, if he got a bruise, if he got a dig, he eye big, he eye small, he twist up, he mouth twist. I want to see for myself. So I going to see who is Ricky.
Yeah,
So I
I
don't
think
know what is the confusion about. She first hit the man, but she did that forgetting that everybody has a camera phone and
right.
phones were out. And that is what a picture tell 1,000 words. And
Yeah.
that is what saved that man. That is what saved him.
Martin
Colin?
Luther King Martin Luther King said that, injustice everywhere is a threat to justice, everywhere. Because look, what people don't understand is when we allow governments to think that they can be oppressive of people and they can do whatever they feel like doing. And today it's Mohammed, but tomorrow it's Camille. The next day it's Jaipal, and then the following day it's Prasad or so forth. It will happen to us as well. And so this is the makings of this very oppressive and dictatorial state. And one of the things that we need to be reminded about is they always want to talk about the PNC and Barnum and so forth. We're in this dictatorship right now. When you can get up and you can criticize the government today and have your contracts taken away from you, have been fired from your job, and by the way, you're not doing anything that is wrong. You're doing exactly what is enshrined for you in the Constitution in Guyana. In the first couple of articles of the Constitution talk about the right to assemble, the right to free speech, the right to an education, the right to so many things. But when you see a government is on their knees, knowing they're going to lose, knowing that the chips are stacked against them, then they become this oppressive. They call it the Leviathan state, right? It's this monster it's railing up and does whatever they like to do. Look, and we've been very clear about this. Mohammed is a private citizen, and he should be accorded with all the rights that are accorded to Guyanese, which is including the right to form his own political party. Let him run for president if he wants to, because we can't say that he can run for president and Sujan can run for president, or whoever the case may be. So he's accorded to that. He's accorded to meet people. He's accorded to his day in court as well. He's accorded to due process. They're finding all these sorts of things, and one of them that I find very laughable is the one with GRA, because if you paid your taxes, and we all know before you get your vehicle, you have to pay your taxes. So after you finish paying your taxes and you make the payment, or let's say you go to a shop, and then 10 years afterwards, the shopman will come and tell you, hey, You know, the apple that you buy, I sell you for $6, but it actually was $16. You owe me $10. It's ridiculous. It's stupid. Nobody buys a car in this country.
He ain't getting the $4 from me.
Nobody buys a car in this country and without registering it, without paying your taxes at GRA. Nobody does that. So he paid the taxes that was allotted at the time. So you're going to come back now and tell him because he's running for president that you want to be able to take more money out of him. So they're trying all these things to get Mohammed to, to sort of give up and to throw in the towel. But as you can see, it's working against them because their own support base is in trouble in Berbice and Essequibo and so forth.
Thank you so much.
And I am happy. I am happy that he made it clear that he's not aligned with the AFC, even though they're touting that he's AFC. He is not with the AFC. And I would like to make that clear. He is not with the AFC. So this touting that the protesters are touting that he's AFC, he's not an AFC member. He did speak to the AFC leader, but that was in a legal sense, not anything to be aligned with the AFC. Because he said it, he's not with the AFC, he's not with the PNC, he's not with the PPP, and I was happy when he said, but then again, Guyanese don't listen, they don't care what you say. Once they get in the head. So I just wanted to put that out there.
Thank you so much, Camille. Any final thoughts from you, Colin?
Yeah, so I mean, this is a great discussion, right? And I think more than anything else, I want the people of Berbice to understand the choices that they have. This is the most consequential election in our country's history. Never been a time where we've had so many access to money. We've been the beloved nation. We've been the nation above and beyond in the world. And so many people want to come and know what is this little Guyana is about. But at the same time, we need to have responsible leadership. We need to have intelligent leadership. We need to have competent leadership. We need to have leadership that will allow for criticism, for ideas exchanging, and not oppressive leadership. It's not leadership when it's oppressive. Leadership facilitates when we're able to say, Camille, this is what you believe in. I want to hear what you think about it. Or Ricky, what you believe in, I want to do that. And this is the kind of leadership I want to say that I'm very much proud to be part of an Alliance for Change. And I think we have a great leader in Nigel Hughes because he empowers every single member to be a leader, to get out there and to be able to ground with the people. And like I said, for such a time like this, that is the leadership that we need.
Thank you, Colin. Thank you, Camille. And before I wrap up, I would like to say this to our fellow citizens of Guyana and to our Barbarian in Region 6 that, and Region 5, that the Alliance for Change has been a political party that strikes the balance of this country. We want to ensure that there's enough balance. We always bring the truth and the facts out to you and to everybody. We have witnessing that there's a very much huge decline of all the sectors in Guyana, non-oil sectors in our country, and that they don't have any answer for that. The government don't have answer to that, and then they are boasting on the oil sectors. The oil sector is the one that's driving all the other sectors. You have to learn to create the sector to be sustainable. You understand me? You have to create policies to ensure that all these sectors can be sustained over a number of years. So, citizens of Guyana, my friends in Berbice, join us next Saturday for our next segment of the Alliance for Change. I want to thank you so much for watching with us, and do support us, do look out for us, and don't follow those persons who want to disrupt any political. The people of this country want to be heard. They want to hear from you. They have a right to come into your community. They want to hear from you directly. Please welcome them. Support whoever is coming to you, no matter who is. Keep the peace. All right. Good night and have a wonderful night.
Good night,
Good night.
Burbies, and thank you
Good
for
night, bro.
watching their lives on the move.